This is a video presentation showing the anatomical topography of the scapular area. First, we begin with the borders of the scapular area. The upper border of the scapular area is a line drawn from the acroclavicular joint perpendicular to the spine. The lower border of the scapular area is a horizontal line running through the lower corner of the scapula. The medial border of the scapular area is along the inner edge of the scapula to the intersection with the upper and lower borders. The lateral border of the scapular area is from the lateral end of the acromion vertically down to the lower border. The skin is thick and active and can hardly be folded. Subcutaneous fat is a single layer, dense, cellular due to connective tissue partitions going from the skin to proper fascia. The superficial fascia can be represented by several sheets of varying density. There are practically no superficial formations. The thin subcutaneous nerves are the branches of the subclavicular nerves and the ramus posterior of the spinal nerves. The proper fascia forms fascial sheaths for the trapezius and latissimus dorsi muscles. The supraspinatus and infraspinatus fascia are the proper fascia of deep muscles. Supraspinatus and infraspinatus muscles of the scapula starting from its posterior surface. These fascia are dense and have an aponeurotic structure. They form two bone fiber spaces by attaching to the edges of the scapula and the spine. They are supraspinatus and infraspinatus spaces. The supraspinatus space of the scapular region corresponds to the supraspinatus fossa of the scapula. The contents include the supraspinatus muscle, the suprascapular artery, vein, and nerve. The infraspinatus osteofibrous space is formed by the proper fascia and the scapular bone below the scapular spine. Infraspinatus fascia is fused with the medial edge of the scapula, the scapular spine, and the lateral edge of the scapula. The contents of the infraspinatus space are infraspinatus muscle, teres minor muscle, and a small layer of fiber located between the muscles and the bone, as well as blood vessels and nerves. The artery and the vein suprascapularis, the arteria circumflexa scapulae, the nervus suprascapularis. This also includes branches of the ramus profundus, arteria transversae coli, perforating proper fascia at the medial edge of the scapula. The circumflex scapular artery, on its way from the axillary fossa, also pierces this fascia, but at the lateral edge of the scapula. The skin of the scapular region receives sensory information from the medial branches of the posterior rami of the cervical nerves C4 to C8 and thoracic nerves T1 to T6. The skin over the lateral scapular area overlying the deltoid muscle is innervated by the branches of the superior lateral cutaneous nerve of the arm, which is a branch of the axillary nerve, that goes through the foramen quadrilaterum. The first vascular nerve bundle, which runs through the suprascapular notch, contains the nervus suprascapularis from the plexus cervicalis and innervates the supraspinatus and infraspinatus muscles. The arteria suprascapularis arises indirectly from the subclavian artery via the thyrocervical trunk. The suprascapular vein is the vein running above the scapula and drains into the jugular vein. The second vascular nerve bundle contains branches of the thoracodorsal nerve. Arteriocircumflexus scapula from the thoracodorsal artery runs through the foramen trilaterum, and the circumflexus scapula vein runs through the foramen trilaterum and drains to the thoracoepigastric vein. The last bundle that contains the dorsal scapular artery from the transverse colli artery and the dorsal scapular vein that drains into the subclavian vein. The branches of these three arteries anastomose with each other in the infraspinatus tissue and inside the infraspinatus muscle. As a result, the so-called scapular artery will lateral circle. The tissue of the lateral triangle of the neck along the suprascapular bundle. Tissue of the axillary fossa along the way of the arteria and the vena circumflexa scapulae through a trilaterum foramen. Tissue of the subdeltoid space along the tendons of the supra and the infraspinatus muscles.